The clinical laboratory, a field in demand. A clinical laboratory is classified as a discourse community in which a variety of tests are done on clinical specimens. Some sample tests include blood, urine, tissue tests, and many more. Clinical laboratories determine the health of the patients, disease prevention, and some treatments that may be applied to these conditions. The importance of a clinical laboratory is that it provides information needed by physicians to treat patients. It also suggests innovations in the treatments. The ultimate significance of a clinical laboratory, though, is the interdependency of it with many other fields that it cooperates with. For example, medicine, pharmacy, business, literature, history, government, and engineering. Writing within a clinical laboratory provides the opportunity for members to communicate their ideas, communicate those ideas between patients and physicians, record any results that must be given without being memorized, establish the validity of the results, and for patient confirmation of the results. The ultimate goal of a writing expert in the field is that its member masters writing in all genres specific to the discourse community, in this case a clinical laboratory. No assistance must be provided from any external sources such as a partner, notes, internet, or an instruction manual. A writing expert in the field goes through two main phases, a training phase and the practice phase. The training phase is estimated to be about 2 days to 1 week, in which a member learns about the equipment, procedures, and safety of the laboratory. The practice phase, which is about 1 to 2 months, is where the member seeks assistance from their peers, familiarizes themselves with the equipment and the procedures of the laboratory. The estimated time is about 2 months and 1 week to achieve writing expertise. Eldon cards, blood donor cards, and laboratory request forms are some of the many genres used in the clinical laboratory. An Eldon card not only provides the name, address, and birth date of a patient, but it also provides the blood type, A, B, AB, or O, and the positive or negative rhesus. The ultimate purpose of Eldon cards is for ABO blood typing. Some requirements for genre mastery include that the member understands the chart and uses it and memorizes it. The member is able to determine if a patient has A, B, or O blood type, as well as positive or negative, and they should also understand the antipositions, which involve the antigen markers. They also must know the procedure in order to determine what blood type a person has, whether it's coagulated blood or smooth blood. An Eldon card is convenient because it is a quick and simple method for determining blood type. The neat part is that no technology is needed in order to do it. Some alternatives include Punnett squares, which must be filled out manually, blood tests, which require some time, and to actually donate blood, which also requires time to do. Upon the completion of an Eldon card, blood donor cards can then be processed. Blood donor cards contain patient information such as their name, date of birth, and gender, as well as their blood type, and on the back is a chart showing the donor and recipient information. The purpose of a blood donor card is to verify that a patient is eligible to donate blood. Some requirements for genre mastery include that the member understands the ABO blood type system, understands how to format the cards, such as institutional names, symbols, and the accurate patient information that must go along with it, which must be filled out manually. Blood donor cards allow for the avoidance of errors that may occur in determining the donation of blood types. It also avoids errors that may occur in blood transfusions. Some alternatives to the blood donor cards include blood type buttons, which include the blood type of an individual, and blood type wristbands, which also include the blood type of an individual. In order to receive donor cards and Eldon cards, though, a laboratory request form must be filled out first. Laboratory request forms are filled out by a patient and provide a plethora of information about the patient that a clinicist needs in order to carry out the laboratory test. Some information includes the patient contact details, the urgency of the test, fasting or non-fasting, the type of test required, and the drug therapy recently taken. Laboratory request forms involve the tests of body fluids for the presence of antigens. Some requirements for genre mastery include to memorize any abbreviations associated with the laboratory request form, understanding the tests that are offered, ensuring that the patient information is correct, and understanding the effects of recent drug therapies on patients. Essentially, laboratory request forms provide patients with information about their health. This offers a method for receiving prescriptions. Some alternatives to laboratory request forms include computerized request forms, which may be filled out via computer and sent to a laboratory nearby, or a wait list at a laboratory which offers less information, such as a name, test requested, and the date. Not to forget to mention that clinical laboratory scientists get to wear fancy safety goggles and lab coats. They also become masters in saving people's lives, as well as masters in the genres of an Eldon card, blood donor cards, and laboratory request forms.